Well, welcome to this presentation. So glad you're back and with us. Right now we're going to talk about phonological abilities of children who are deaf and hard of hearing, those with cochlear implants in particular, but we're also going to talk a little bit about kids who are hard of hearing. So I want to just again acknowledge that a lot of the research that I'm going to be presenting was developed because of a grant from the National Institutes on Deafness and Other Communicative Disorders, and that several facilities were instrumental in completing this study: Child's Voice in Wooddale, Chicago, St. Joe's Institute in St. Louis, Missouri, St. Joe's Institute in Indianapolis, the Moog Center in St. Louis, and Ohio Valley Voices in Loveland, Ohio. And again, my research collaborators were Jongmin Jung, Diana True-Kloiber, and Denise Bradford. So let's get started. As you remember from Talk 2, cochlear implants provide increased auditory access to conversational intensity speech and auditory feedback for the child, thereby increasing opportunities for incidental learning and the development of phonological systems. They provide children with a wide range of hearing, from low pitches to high pitches, and that enables children to develop a complete array or inventory of phonemes, at least hypothetically. But speech intervention is usually needed because of a relatively late start in auditory guided speech development. CI thresholds are sometimes not within the normal hearing sensitivity limits, and speech is represented electronically and not naturally. So speech pathologists and teachers of the deaf keep in mind these sorts of reasons that kids who have cochlear implants might not be making expected progress. So let's talk about the first 2 years of cochlear implant use. And I have a task that was developed called the open and closed set task. And it asks, do children show increases in their abilities across time after they get a cochlear implant? There are 3 main areas that are assessed: phoneme accuracy, that's just the ability of the child to imitate vowels and consonants in words; word acceptability, sort of a measure of intelligibility among children's word productions; and word comprehension, which measures how well children understand early emerging vocabulary words. So we used the open and closed set test, and we administered it to children at 12 months, 18, and 24 months after their cochlear implants were turned on. So for phoneme accuracy, you can see at 12 months, children were about 50% correct in producing the consonants and vowels in the target words. That increased to about 70% at 18 months and slightly greater at 24 months. For word acceptability, similar profile then, about 50% up to 70 and then 80% at 24 months. Word comprehension, again, we're not talking about percent here, we're talking about the number of points received. And scores increased in the same way, where we see a mid-range score and then increased to 18 months and a plateau after that. And when we looked at total scores, no surprise. It's the very same pattern again. So what does this tell us about these areas? Well, young children who have cochlear implants showed moderately high scores in phoneme accuracy and word acceptability and word comprehension after 12 months. They were right around 50%. Scores increased up to the 75 or 80% level at from 12 to 18 months. And at 18 to 24 months, the scores were quite similar. There was a plateau there. Consonant and vowel production improved substantially during the second year of cochlear implant use, from about 50 to 70%. But the moderate scores we see at 12 months, right around 50%, suggest that the child had already made gains during the first year of their cochlear implant use. And so it was recommended, and we recommend that the ONC be given at 6, 12, and 18 months to capture that progression to capture their earliest improvements, and then for the course of 18 months, further improvements. The reason we originally gave the O&C at 12 months was because we didn't realize that kids with cochlear implant would be increasing their vocabularies so much. And so we scheduled that test for 12 months post-activation. But in a way, it was a lesson to us not to underestimate how children with cochlear implants can improve their abilities in spoken language. So that was one study about speech development in really young cochlear implant users. Here are a couple of small N studies that also tell an interesting story. Warner, Sis, and Davis in 2008 had 4 cochlear implant users they studied. They were implanted at 20 months and had 8 months of cochlear implant use. And the authors analyzed spontaneous speech samples. And what they found was that the control group of typically developing children were 7 times more accurate than the CI users in terms of consonant production. But vowels were produced with comparable accuracy. So there's a big difference in consonant production among these 4 cochlear implant users. Kind of a surprising finding, in fact, to see that big difference between CI users and typically developing children. So Warner and Sis and colleagues decided to look at that group again, and they looked at 6 different cochlear implant users. At around 16 months is when they were implanted. They again analyzed spontaneous speech samples, and they did that for 6 months after the onset of spoken words. And what they found was both the TD and the CI group increased their consonant and vowel production by 6 months. But the TD kids were more accurate in consonant production than the CI kids, just as in the previous study. But now the gap is only 55% accurate to 43% after 15 months of sampling. So what you see is the first study showed a huge gap between the two. Then a different group, we see a much smaller gap. In another study of consonant accuracy, Lisa Goffman and I at Purdue University studied 6 young cochlear implant recipients who were implanted about 24 months of age, and they all had 2 years of cochlear implant use. So we only analyzed their speech sample from 24 months post-activation. And we included 6 children who were typically developing and that were matched for age and for gender. And we had the children imitate 60 different words from 4 developmental sets based on the initial consonants. And each word was imitated 3 times to assess how variable the child's productions were. For example, if the word was boat and the child said boat, 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 then they would have 0 variation. But if they said boat, boat, coat, they show signs of variation. And so let's talk about the 3 or 4 sets of words. We had words that we called set 1. They all began with P's, B's, N's, H, and M's, and W's. Set 2 was T, D, K, and G. Set 3, F, L, Y, S, and Set 4, V, Z, Sh, J, and Sh. So as you can see, we would expect set 1 to be mastered and emerge earlier than set 2, then set 3, and then set 4. So here's what we found. When we looked at initial consonant accuracy, the left chart here, you can see we have percent correct on the y-axis, and here are the scores for set 1, set 2, set 3, set 4. The dark black columns are the cochlear implant users. The light gray are the typically developing children. And here for set 1, the earliest emerging sounds, you can see scores are very close, and they're high level in terms of accuracy. For set 2, we see a wider gap for the between the 2 groups, the typically developing and the cochlear implant users. significant difference there. And the same in set 3, we see a big difference with the set 3 consonants. And we also see a big difference, although not as big in set 4 as in set 3. So take-home message here, we can expect kids to who get cochlear implants and during the first 2 years of cochlear implant experience, we can expect the earlier emerging consonant sounds to be produced with greater accuracy than the later developing sounds. But still, children lag behind typically developing age peers. Second chart on the right side, then we can see we looked at variability. And you can see that in each case, we see that the cochlear implant children for set 1 were slightly more variable than the typically developing children, set 2 even more, set 3 more variable, and set 4 more variable than that. So not only does accuracy lag behind the typically developing kids for the cochlear implant users, but also those children are more variable. And variability is not necessarily a bad thing in that we know as children are learning new tasks, say jumping rope or playing tennis or skipping, for example, sometimes they're going to get it right and sometimes they're not. It's part of the process of acquiring consistent speech sound. But this study kind of documents for us the developmental delays that we can expect and the fact that children are going to be more variable. The next study that I completed with Jongmin Jung and Diana Trukloiber looked at consonant accuracy in young children with cochlear implants, and we examined further those developmental sound classes and word position effects, initial versus final consonants. And in this study, we had 11 prelingually deaf children. Each of them had 2 years of cochlear implant experience. They were all implanted before 36 months, most around 18 is the mean. They were oral communicators and they'd all received early intervention. So these kids, it's sort of the ideal group. They're getting what they need. And then we matched them with 11 typically developing children who were age and gender matched. And we administered a test called the Assessment of the Link Between Phonology and Articulation, or ALPHA. And ALPHA was developed by Robert Lowe, not to be confused with the movie star Rob Lowe, okay, just to get that straight. Anyway, we chose the ALPHA because it assesses words within the context of a sentence. So instead of asking a child to say the word broken by itself, the ALPHA has a picture of a broken pencil, and the sentence is, "My pencil is broken." Okay? And then the word broken is analyzed there, for example. So for data analysis, we looked at the percent of correct for initial and final consonant, the percent correct for early, middle, and late developing sound classes, and I'll show you those in a minute. And then we asked these research questions. How closely do consonant accuracy scores of young cochlear implant users match those of typically developing controls? How accurately do young cochlear implant recipients produce consonants in the initial versus the final position of words? And do young cochlear implant recipients show typical patterns of consonant acquisition? That is, do the early emerging sounds from typically developing children have higher scores than the middle emerging and late emerging phonemes? So here are our findings. The left chart shows the results for consonants in the initial position, and the right chart shows final positions. So if we look at the left chart, and again, this is percent correct for early, middle, and late sounds. The percent correct shows for the typically developing kids, the dark box columns, that yes, they show developmental progression in that early sounds are produced with greater accuracy than middle and middle with greater accuracy than later. And the same pattern can be seen in the cochlear implant users. So in the left chart, the early position data show that the typically developing kids produce the early better than the middle, better than the late, which is what we expected. It's the typical pattern. And similarly, for the CI users, we see the same sort of progression. Now you can see that the CI kids have lower means than the typically developing kids in each case, but none of those reached significance. As far as the final position, we see a totally different picture. We don't see that drop-off for the typically developing kids across the early, middle, and late sounds, and we don't see that pattern for the CI kids. However, we do see larger gaps between the cochlear implant users and the typically developing children. So let's take a look at the speech sounds that were most and least affected in terms of accuracy. So in this chart, we see early, middle, and late sounds, and here are the specific sounds, and in parentheses are the number of times they were produced by each child. So for initial consonants, I think you can see for early sounds how closely the CI users approximate the accuracy of the typically developing children who are represented by filled boxes. But when we go to the middle sounds, we see larger gaps for some sounds, but not all. And L's and S's were among the most lowest accuracy sounds. But look at the late emerging sounds. Here we see that the greatest difference between the two groups is for Z, but then th and and th are all produced with comparable accuracy, even though they're lower accuracy. They're low because these are later developing sounds. However, Z appears to be a sound that is particularly difficult for kids with cochlear implants compared to typically developing kids. Let's move on and talk about the final consonants then. Here we have fewer final consonants just because the alpha test didn't give us many choices. But again, you can see that in this case, when the consonants are at the final position of the word, we have considerable differences between the CI users and the TD children, even though these are early emerging sounds. And we see similar large differences for several of the middle emerging consonants. But when we come to the late emerging sounds in the final position, you can see sometimes the CI users are right on task. They can produce sh as well as typically developing kids. And I can almost see you nodding your heads and saying, I know why. And that's cochlear implants seem to represent SH very strongly. And so kids are very aware of SH. But similar high-level accuracy or close to high-level accuracy can be seen for and L as well. So an interesting pattern here. Probably the take-home points from these studies are that young cochlear implant recipients do make substantial progress in consonant and vowel accuracy. They still lag behind typically developing peers, age peers, after 2 years of device use. They show more variability than typically developing children. Some initial consonants seem to develop easily, and those would be early emerging nasals and labials. Others were more difficult, fricatives and liquids. And final consonants were more difficult to acquire than initial consonants in general. Why would that be? Well, as you probably remember from your acoustics classes, initial consonants appear to have greater perceptual salience. That is, we kind of reduce the emphasis on final consonants in words compared to initial consonants. So that might make them harder to hear. And it's also possible that in intervention, we might be guilty of overemphasizing initial position consonants and haven't spent enough time with final consonant accuracy, or to carry it a little further with medial consonants as well. So let's change the topic just a little bit and talk about kids who are hard of hearing, not cochlear implant users. These are kids who have more usable hearing and benefit from hearing aids. And in a rather large-scale study by Sophie Ambrose and her colleagues at Boys Town and the University of Iowa, they looked at 70 children who were 3-year-olds and had mild to moderate to severe hearing losses, and then typically developing controls. And what they found was that 63% of the kids who were hard of hearing had phonological accuracy scores within normal limits. They're using their hearing, and intervention is helping them to produce speech sounds accurately. But about a third of the children had scores that were more than 1 standard deviation below normal. So a sizable portion of children weren't up to the age peer level. And further, it should be noted that 10 children couldn't even complete the word imitation task. And these children weren't included in data analysis, but when we think about children with who are hard of hearing, this tells us that maybe more than a third of the children who are hard of hearing are going to have some difficulty with phonological development. A related study by Tomlin et al. Found that when we look at this wide range of kids who are hard of hearing, from mild to severe hearing losses, that there is a cutoff that affects phonological ability. Tomlin found that kids who had pure tone threshold averages of 45 or greater had poorer phonological skills than those who had pure tone averages less than 45. So that's a useful metric to keep in mind when we look at our caseload and think about who's going to need the most help. So some take-home messages for kids who are hard of hearing. There's a lot of variability in their phonological abilities, and that the severity of their hearing is an important factor for helping them develop phonological skills. All right. So what are some factors that also that also affect progress? Aided hearing levels, we've talked about briefly. Age at identification of their hearing loss, earlier being better. The presence or absence of a secondary disability. Those without a secondary disability may be inclined to perform better. The age at which children first receive services. You remember from our preceding talk that Muller showed that kids who begin intervention by 11 months outperform those who receive intervention after 11 months in terms of spoken language. Familial involvement, of course, is very, very crucial to helping children develop phonological skills. And then the fourth one is related to you. Your understanding, your knowledge base, and your experiences in providing speech intervention to children who are hard of hearing or to children who have cochlear implants is key to having effective intervention. So here are some references for you, and several books that will help you consider the special needs of kids with cochlear implants or kids who are hard of hearing, and ways to help them in terms of intervention and assessment, which happens to be the very next topic for our next talk. So thanks for tuning in, and we'll see you shortly.